right here between the eyes. Okay? We move posterior, and we have the parietal bones. So if you just go like this on your head, that's where the parietal bones are. Between the parietals is the sagittal suture. So that would be the same direction as the sagittal plane. Where the sagittal suture intersects the coronal suture is known as the bregma. In the center of the skull, approximately where this hole is the vertex of the skull. That's on your list also. In the posterior, the parietals articulate with the occipital bone, which is back here, and that's the lambdoid suture, or lambdoidal suture. And then where the sagittal suture intersects with the lambdoidal suture, that is called the lambda. You cannot, well, if you take this off, it tries to give you an idea of diplo, because they put some little tiny dots in here. And y'all remember what diplo is, right? Spongy bone in the flat bones. Okay, squamous suture bone, vertex. Okay, I went through all that. All right, let's take a look at the occiput. The occiput here in the posterior. This big bump on the occiput is the EOP, or the external occipital protuberance, right here. In fact, if you run your hand down the back of your head, you should be able to feel the EOP. Mm-hmm. If we turn the skull upside down, you can see the occipital condyles on either side of this big opening here, which is the foramen magnum, and that's where what comes through here? Spinal cord, right. Once it comes out, that's called the spinal cord. Let's see. Now, the internal occipital protuberance is right here. That's that big bump on the inside of the occiput. It's getting kind of scary now.
Sorry. I know, everybody's like,
all right. Yeah, right here. Internal occipital protuberance. Now we have three fossa in the base of the skull into which the lobes of the brain sit. The anterior fossa, the middle fossa, and the posterior fossa. And you can see they're like little basin-like depressions. So we have the frontal lobes here, and we have the temporal lobes will be in this area, and then the the cerebellum will be back in this area here. Okay, and the occiput's going to be back here. All right, and the clivus, all right, this part here is this area in here is the sphenoid bone. And you have this little space in the sphenoid bone, which is known as the sella turcica. Now, remember, right, we talked, I don't know if you remember, did we talk a little bit about the pituitary gland and how important it is? Mm-hmm. And that it was, if you took a line through the top of your head and right through your nose and they intersected, that's where the pituitary gland would be. That's where the pituitary gland sits. It sits in this part of the sphenoid bone called the sella turcica, which means somebody's Turk's saddle. That's it. Sella turcica. It means somebody's saddle. The sella turcica. And this is the posterior part of the sella turcica. Remember, we're looking at the sphenoid bone, and this is called the dorsum sellae. And then when you slide towards the occiput, back here is the occiput, that's the clivus. So you slide down the clivus right here. This is the clivus, this area right here. So it's inside the cranium, the clivus.
So the clivus is the
right
horn
here.
part.
No, it's not the horn.
Right behind it.
It's right.
You're enjoying sliding down that clivus,
dorsum
aren't you?
sellae.
Yeah.
This is the dorsum sellae, and just posterior, it's like a slide into the foramen magnums, the clivus. In fact, remember I mentioned that. Did I mention to your class the relative I had that had a tumor in that area? Mm-hmm. That was called the clivus chordoma. That's where the tumor was, right in that area. No,
No,
they
they got
went in
it.
there. They went in. They pulled the squid out of his head.
Oh
And he's still crazy. So.
yeah.
Okay, so that's the occiput. Now we'll go to the temporal lobes. Let me put his hat back on here. Put your head back together. Like, there we go. Okay. All right, the temporal lobes or temporal bones. We have two of them, and they're on the lateral aspect of the skull here. Here, so we have them on both sides, and the temporal bone houses the organ of hearing. So we've got on the temporal bone we have the mastoid process here, the external acoustic meatus. What do you think is in there? Yeah, well, not just the middle ear, but we go once we get past the external ear. Once we start going in the ear canal, the middle and inner ear are in the bone. They're in the temporal bone. And then we go inferior to that, this little projection here, this is called the styloid process. And a lot of swallowing muscles are attached to the styloid process.
Can you turn that this way?
Sure. That's the mastoid bone, styloid process, external acoustic meatus.
The styloid's the little thing that hangs down.
Yeah, the little, like remember old record players?
Yeah.
Everybody here remember the record player?
Oh, yeah.
Y'all, you remember record player, right?
I have two.
You have two, okay. The stylus, okay, so that kind of looks like the stylus of a record player. A lot of swallowing